Hello, my name is Patrick Murray. I am the nursing director here at the University of Minnesota East Bank. We are part of a 12 hospital system with Fairview, which also includes Health East now. So within the 24 suites on the East Bank where I help support, we do all kinds of types of surgery. We do about 12,000 cases a year. And it's kind of a mix, so majority of inpatients, surgical admits, and outpatients. A lot of the outpatient volume has gone to our surgery centers and other locations, but there still are patients because of case complexity, whether they have a high BMI, other comorbidities, previous transplant type patients. They need to still be done in a hospital setting just for safety reasons. Of the types of cases we do, a lot of complex CV, all kinds of transplants, so whether it's heart, lungs, liver, kidney, pancreas, all of that kind of types of surgery, gyne-onc, so a lot of cancer type of surgery, staging, plastics to follow up on those types of cases. Also, we do a lot of specialty stuff. So the room you're standing in right now with me is an IMRI suite, so intraoperative magnet. So literally, if you look above us right here, you'll see there's some rails on the ceiling. So what happens in this type of room, which is a little more unique than some sites, is we'll have you on the table as a patient. We'll get you prepped, we'll get you ready, we'll do exposure, but then we say, okay, we need to do some imaging with an MRI. Literally, there's a set of garage doors right here that open up, and a full-size MRI machine comes through on the rails, we'll take a scan of you, and then we drive it back in. It's also unique because some sites, they'll have to do the MRI before the case. They'll sometimes do surgery, try to temporarily close, take you to another location to do the MRI, and then bring you back into the suite. Here we get to do it all in one spot. So it creates great efficiencies, but also it's a lot safer. Some other things that we do unique is robotic surgery, which isn't as unique as it used to be, but we're state-of-the-art, 2 different robot rooms where we have training consoles as well, because as an academic center, we do a lot of teaching, which, yes, people get proctored at other sites, but because of all the fellows and residents we have, we get a great opportunity to train on all of the services we provide, but also on the equipment. So having a dual console robot is kind of a nice thing to have here too for training. Beyond all the complex cases we do, I talked a little bit about outpatient surgery and people having to go to other sites, but because we are the academic center, we do the most complex. We have the highest level ICU. I'm not just going to say within our system, I kind of boast a little bit about us, I'm a little proud of East Bank, but I'd say in the region, I think we rival Mayo in a lot of things, definitely in research, but also in coverage of type of patients we do. When we think about ECMO and other life-saving measures, you can't get those things at other sites. So why I bring that up is there's a time and a place for every patient. We end up being that place for the majority of patients. We don't try to push any patient away, but there are cases we say, you know, that's not, the complexity of that patient isn't high enough maybe for this site, or we look to other partners within our system to say, could they go elsewhere? So there's a lot of coordination that goes with our patients, which gets into some of my training. I didn't do an MHA, I did a master's in business, but there's a lot of coordination that comes with healthcare that isn't just about the clinical aspects of how do you cut and how do you what staples do you use, all those types of things. A lot of it comes into the coordination of healthcare. So other things which we don't need to pan the whole room, but you see there's supplies and equipment, all the logistics things that come into this play into how do we care for patients here at the East Bank. And hopefully you'll get a little bit of exposure to West Bank. I believe you're going to do a tour over there as well. Very complex as well. When I talk about some of our coverage, we're partners not just with East and West, but we're partners as a hospital system. So West Bank, for example, does a lot more pediatrics, and they do a lot more orthopedics than we do. So we kind of share our expertise, and not that orthopedics can't be super complex, or the patient's needing a higher level of care if it's the adult ICU that we have. We do that coordination and we share. So when I talk about logistics, not just for supplies, we do logistics for teams. So there are times our surgeons go across the river to the West Bank because that's the right place for that patient. And similarly, we'll bring surgeons over here, we bring anesthesia over here, we bring staff over here, and we try to move a little bit between sites. Always complexities with that because you're usually most competent and confident in your home base, but there's times that we have to make those adjustments to be the best place and the best people for our patient. So if they can't move, we will move to them. Similar with equipment and supplies. So all that stuff's always moving as a 12 hospital system. But East Bank, because we kind of have, for adult related complexities, the most equipment and the most complex equipment, a lot of the stuff does come here. So it's pretty unique to be here, you know, or not be here all hours of the day and hear about, oh, we have a patient up in Hibbing, and they have this going on, and the surgeons are talking, and then leadership is talking and saying, okay, when can we get him here? Do we have what we need? Pretty unique site for those types of things.